Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
With us today on this Meet the Experts, we have Nicole Knight, Executive Vice President of Revenue Cycle Solutions and Care Transformation Services at MedAxiom. So Nicole brings deep expertise in cardiovascular operations, coding, compliance, and lean process improvement. She is a sought-after speaker and advisor known for helping practices optimize performance and financial sustainability across the entire revenue cycle. So welcome, Nicole.
Hi, Melanie. How are you doing?
Good. We get to talk a lot on Heart Talk, but in person. Very nice to see you. So let's talk a little bit about that aha moment. I know you've told us before, but when did you know that this was the career that you wanted to pursue?
You know, when I started my career in nursing and felt that my aha moment, my mom used to tell me I always played with medical kits and everything when I was younger, and then my dad and grandfather and his brothers all had heart disease, and I was always interested in taking care of people and taking care of their hearts. So I think my aha moment was when my grandmother got really sick and I was in nursing school and was able to take care of her and realized that I wanted to always do something in healthcare to be able to help patients.
Mm-hmm. That's always a sweet moment, though, when you're able to use what you've learned to help a family member. Yeah, there's a lot of good feelings in that. Well, with all your expertise in revenue cycle and coding, what's one area where cardiovascular practices could immediately improve compliance and reimbursement?
I think the biggest thing is aligning the clinical documentation from their physicians and their providers with the intent of the coding and billing. A lot of times that messaging is not good, and those relationships can be difficult when you're trying to explain all the guidelines and the rules of billing. But I think a quick win is really talking to them about their documentation and aligning that with the coding and billing guidelines. And you'll always have a win with that because you'll get all the information you need to successfully get reimbursed from that documentation.
Yeah. So you've implemented lean process improvement across many settings. Tell me a success story that kind of really sticks with you.
I think the biggest one with the lean process that in my career has been around device clinics. So with our device clinic monitoring and technology, that's several advances now with how we can monitor our patients remotely at home. It used to be you had to dial up on a telephone and monitor their pacemakers or their devices, and now it can all be done electronically. And did a big project in that space in remote monitoring and was able to streamline the processes, eliminate waste, and really increase their revenue from capturing all the charges and just improving the overall processes and decreasing the waste in that space, and seeing them have that improvement of their staffing resources and being able to make that program successful.
Yeah, very satisfying when you see the end results there.
Yes.
So what should cardiovascular leaders know about the future of risk adjustment and complex procedure coding?
So risk adjustment is becoming more and more prevalent, especially with our Medicare Advantage plans. And with Medicare Advantage being funded even more by Medicare, that risk adjustment coding and those complex procedure coding and capturing all the diagnosis for the patients is really going to help not only illustrate the patient population, it also helps with reimbursement and supporting that value-based messaging and that value-based care to truly keep our patients at the center.
Right. You know, coding and compliance consulting work can get intense, but what is your go-to way to kind of decompress after a long day or a business trip when you're just like,
Yeah, I tell you, for me, it's truly either going for a walk on the beach or just listening to a mindless audiobook. That is really my go-to, where it's not anything I have to think about, and it's truly, and I love a good romance novel, so that's my go-to. Not particularly, but audiobooks have been my thing, so it's really gotten, and even podcasts, listening to things on the airplane and just zoning out after a long day and project around coding and billing, it's always great just to have a good romance novel.
Yeah. So you've got a deep background and skills in a number of specialties. But if you could master one completely unrelated skill overnight, so one day, that would be awesome, right?
It would be awesome.
What would that be?
I think for me it would be actually cooking. I am not the cook in my family, my husband is, so if I could make him one good meal after being married for 29 years, I think that would be something. If I could master making one good meal for him overnight, I think
that's so nice that you would say that, because I would probably be like, you're good. What does he cook? What do you love?
He cooks everything. So we have that Louisiana background, so he loves to cook, and I am just not a good cook at all. So if I could master even baking chicken or making one dish, I think I would be happy.
There's a lot of YouTube videos out there, but you have a good husband. Yeah, yes, give him a shout out right now. Okay, so what is one thing that maybe people would be very surprised to learn about you?
I think if I had to, I'm pretty much an open book for all of those that I interact with. But I would say that I think the biggest thing is that I do like alone time. I am extroverted and I love to socialize and I love to be with people, but I do like that alone time as well.
Read those romance novels and just veg out, right? Yes. Yeah. All right, Nicole, thank you for joining us today on this Meet the Experts.
All right. Thank you very much, Melanie.